Members, you are hereby summoned to attend the monthly meeting of the Health and Community Committee, which will be a hybrid socially distanced meeting to be conducted remotely via WebEx and physically in the Council Chamber, Guildhall, on Thursday the 10th of March 2022 at 4 p.m. So just commence with the attendance. Alderman Devaney.
Here, Karen.
Alderman Guy. Alderman Kerrigan.
Here, Karen.
Councillor Sonoya Barr.
Here, Karen.
Councillor Michaela Boyd.
And Shaw here, Karen.
Councillor Carr.
Here, Karen.
Councillor Duffy.
Councillor Duffy sends her apologies, Karen.
Okay. Councillor Edwards. Councillor Farrell.
Here.
Councillor Ferguson.
Here, Karen.
Councillor Fleming. Councillor Harkin.
Here.
Councillor McGinley.
And Shaw.
And Councillor Tierney.
Here, Karen.
Okay, and let's do a double check there on Alderman Guy.
Here, Karen.
Okay, thank you. And Councillor Edwards. Okay, thank you, members.
Thanks, Karen, and thanks, members and officers. Item 3, the broadcasting statement, if I could read that, please. I would like to remind everyone present at this meeting in the Guildhall or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you are consenting to being filmed and to the use and storage of those issues for the broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of the Council Privacy Notice may be found on the Council website. Item 4, members, is declaration of members' interests, either now or as the meeting goes on. And members, on your behalf, could I welcome the deputation here today from the Western Trust around a very important and pressing issue of domiciliary care. And in attendance, we have Mrs. Donna Keenan, Acting Director of Primary Care and Older People's Services, Executive Director of Nursing. Mr. John McGarvey, Assistant Director of Primary Care and Older People's Services. Mr. Martin McGeady, Head of Home Care. And Mr. Oliver Kelly, Head of Communications from the Western Health and Social Care Trust. You are all very welcome. And as you will know, this is a hybrid meeting where we have councillors and officers in the chamber, but also people coming in by virtual WebEx. So if I could hand over to the deputation, and if I could suggest to yourselves, if we hear from yourselves, and then I will open it to the floor in terms of councillors. Okay, thank you.
Thank you, Chair. I'm going to hand over to Martin, who's going to do a presentation, and then happy for questions afterwards. Thank you, and over to Martin.
Okay, thanks, Donna. I'm not so sure. I submitted the copy of the presentation to the council in advance. That's fine. Thanks for that. Okay. First of all, can I just thank the council for the opportunity to attend this afternoon and provide this brief presentation that should provide hopefully some clarification and an outline on the domiciliary care or home care services provided by the Western Health and Social Care Trust. There are approximately sort of 7 slides, so I've attempted to keep it as brief as possible. It is a very wide-ranging issue, so if there are any particular issues that I haven't included but that you're keen to explore, then I'm happy to do so as part of questions towards the end. Just in terms of setting the scene, what I've done is attempted to get an outline in terms of the scale and activity of the domiciliary care services provided by the Trust. I've identified what our key challenges that we currently face are. I look at one of the challenges in a wee bit more detail, and that being in terms of workforce planning and workforce supply, and introduce some of the solutions that we are pursuing to address that particular challenge. And then I touch on some of the wider developments that the Trust is pursuing in terms of improvement, both in terms of the quality of the service that we provide and increasing the accessibility of services for the local population. And I'll touch on two of those in particular, which are fairly prominent items locally, and that is the retender of domiciliary care and the optimization of our services through a specific project looking at that. So if you're happy to proceed on that basis, I'll make a start as such. So next slide, please. Thanks. Just in terms of the metrics, the total number of service users that we provide services to trust-wide is just short of 3,700. And the total number of total number of individuals who would access their service in the course of the year would be just short of 6,000. So at any given time, we have about 4,000 service users on our books, and typically in recent past, in any given year, we would have about 6,000 people that would pass through our service. The service, as you know, trust-wide is split across what we term as the northern and southern sector. The northern sector of this trust is broadly coterminous with the Derry City and Strabane District Council areas, and that it covers Cityside, Waterside, Strabane and Castledaird, although there would be an element of our Waterside locality that would encroach into the Causeway Council area. So our total hours delivered in the course of any given week is about 45,000 hours of care delivered in a week. And that's roughly split 50-50 between the Derry City Strabane District Council area and the remainder of the Trust. That equates to about 75,000 home care visits. So 75,000 home care visits in any given week equates to 4 million visits in the course of the year. So you can see it's a huge service. It requires a great degree of coordination to ensure that the right care staff are with the right people in the right place at the right time. So the logistics behind it is a huge challenge for us. Those weekly visits, those 75,000 visits, again, roughly split 50-50 between the Derry City and Strabane District Council area and the remainder of the Trust. I think there is a sort of a common perception that care is very difficult to access at present, and there's no doubt there's an element of truth to that. But nevertheless, in the course of the past year, we have accommodated 2,236 new cases. So that's about 43 new people accessing domiciliary care each and every week on average. But as I say, there is a considerable element of unmet need, and that is a huge challenge for us at present. There's about 400 service users who are waiting for care. Now, that's either waiting for a component part of an already established care package or the entire care package, and that's split broadly 50-50. And there's 400 of those individuals waiting for over 3,000 hours of care, again split roughly 50-50 between the Derry City Council area and the remainder of the Trust. So that gives you a sense of the level of activity and the activity specific to the domicile or to the Derry City Strabane District Council area. Overall, in terms of spend, it equates to over £30 million per annum in terms of investment that the Trust spends in domiciliary care. Next slide, please. There are a number of challenges that we face at the minute. Obviously, the huge issue in terms of demographics. I mean, we have seen our population growing older. It's a population that's living longer with complex health and social care needs. So the sort of basic problem that we have in terms of, as illustrated by our unmet need, is that balance of the demand for services and our ability to meet that in terms of supply. And that unmet need comes from both people awaiting discharge and coming out of hospital and from within the community setting as well. We're also seeing challenges in terms of increasing complexity. As I say, people are living longer with more complex needs. We work closely at the interface with our health and social care colleagues, allied health professionals, to attempt to work collaboratively on a sort of multidisciplinary basis to address those increasing complexity. I've worked in home care for many years, and certainly when we look at the profile of our service users today and the range of needs that they have, they are completely different from what we would have been used to even in the recent past, go back sort of 5, 10, 15 years. But the biggest single challenge that I talked about is our workforce and the ability to get sufficient numbers of individuals who are able to work in the community, who have the right skill set, the right experience to deliver the quality care that we require. And I'll touch on the workforce in a second in a little bit more detail. Rurality is also an issue. It's not as big an issue, admittedly, in this part of the trust that it is in the southern sector, but it still does challenge us. And of course, we've had the impact of COVID, which has been an absolutely huge challenge for us over the last 2+ years. It's still with us and it still remains a challenge for us. In the early days of COVID, we lost a significant number of staff who, in reality, are older staff who probably brought forward their retirement by maybe 2, 3, 4 years because of the advent of COVID. And just in terms of the whole sort of impact of COVID, in terms of COVID fatigue, I think we have seen an increased level of staff turnover in that respect as well. I did pull together this presentation probably about 2 weeks ago, and if I was doing it again this morning, I would be adding another challenge to us, and that's the recent increase in terms of fuel prices. It's a very real and sort of recent development that we've had, and it certainly is challenges in terms of extending the care out, particularly to those hard to reach areas where the care staff are required to travel that little bit extra. So that's a more recent development that's come upon us as well. So next slide, please. Okay, just to go into the detail of the workforce a little bit. Probably aware the home care workforce or the home care service across the Western Trust is delivered through a combination of in-house service, staff directly employed by the Trust. That accounts for about 27% of the activity that I previously sort of referred to, and about therefore 63% within the independent sector. In terms of the in-house, we employ just over 470 staff. About 263 of those are in the Derry City Strabane District Council area. They're employed under NHS Agenda for Change terms and conditions and would be band 2, so that's at the lower end of the scale. And their basic rates of pay range from £9.77 an hour up to £10.50. Although they do attract generous enhancements for working on social over weekends, bank holidays, Saturdays, evening shifts, etc. And they do get the same travel expenses as any staff member employed by the Western Trust. Our staff have permanent contracts and they're on guaranteed hours, so that addresses the precarious nature of work within home care, where staff can see hours rise and fall on the basis of service users who perhaps pass away and come off the caseload, or indeed temporarily are admitted to hospital or the likes. We have an ageing profile in terms of our workforce. Our average age of our staff members is towards the mid-50s. So that gives us quite significant concern in terms of workforce planning in the medium to longer term, and it's an issue that we are currently addressing. And about 98% of our staff are female. Pleased to report that from an in-house perspective, our staff turnover is relatively low, where once we are able to recruit staff, they do tend to stay with us. In terms of the independent sector, there's approximately 2,000 independent sector staff working across the Western Trust, of which about 900 are in the Derry City and Strabane District Council area. Each independent sector provider, of which there are 7 providers across the Trust, there are 3 in the Derry City and Strabane District Council area. They set their own terms and conditions of employment. At present, their basic rates of pay range from about £10 to just over £12 per hour. That's a recent increase based on the additional funding that has been provided to the independent sector as recently as November last year, and I'll touch on that just in a second, and the impact that that's had in terms of workforce. There are limited unsocial enhancements paid by the independent sector. Their flat rate tends to reflect the rates that they pay throughout. They have no standard practice in relation to travel expenses. Some of them pay fairly generous travel expenses, others don't pay any at all. They tend to have variable hours. They don't necessarily guarantee the hours for their staff, and they do have more precarious contracts in relation to permanency. Anecdotally, the evidence would suggest that the independent sector staff has a younger age profile than the Trust, but again, they're predominantly female. About 95% of their staff are women. And our independent sector colleagues would actually report that they do have some really challenging retention issues. They do have quite high staff turnover, which is one of the difficulties that we face. Next slide. Thanks. In terms of the solutions, you will be aware, or you may be aware, that the Minister for Health back in December announced a regional domiciliary care rate of £18 an hour. That was a significant uplift for our 3 independent sector providers who operate in this area, averaging about £3.50, £3.70 per hour of an increase. And that was awarded backdated to the November 21. That, of course, gives significant scope for the providers to enhance the pay in terms of conditions. And certainly the initial feedback from our independent sector providers is that it has certainly provided a great degree of stability within the workforce, and they currently now are actively working to try and look at sustainability going forward and additional capacity within the sector. One of the other things that we're looking at in terms of solutions is looking at being a bit innovative around our recruitment practices. I mean, gone are the days where you could simply put an advertisement in the local newspaper, be inundated with applicants, and be able to be quite selective in terms of who you recruit. We're in a very competitive recruitment market with other aspects of the service sector, competing with retail, hospitality, and the likes. And there is a fairly limited pool of staff that we're trying to go from. So in terms of our innovative recruitment, we're looking at issues like the one-stop shop, where we'll hire a venue for a day. The likes of locally here, we would go to the likes of St. Colm's Park House, where we would invite interested parties in, where we can demonstrate what the role involves. They have the opportunity to speak to our HR colleagues, to our actual care staff who discharge the role. And have the opportunity then to apply, shortlisted, and book an appointment for an interview. And we're finding that has been quite successful, and certainly our return rate in terms of successful candidates from that type of approach has increased significantly in recent times. But we have to look at, and are happy to consider, a range of other sort of innovative recruitment practices, because we do appreciate that the days of, as I say, simply putting an advertisement in the paper no longer works. We're also looking to address the sort of age profile of our staff by linking into sort of educational pathways through the likes of engagement with the education sector through Skills Academy and apprenticeships. This was work that we had begun to advance just pre-pandemic, but unfortunately we've had to put it on hold over the last 2 years, although they are now beginning to revisit this with a view to sort of progressing it in the weeks and months ahead. But what we need to consider is also raising the profile of the role. I mean, domiciliary care does get a fairly bad press. I think it is considered to be fairly menial work that doesn't necessarily provide many rewards. And we are looking at sort of building on the whole issue around career pathway and building on some of the successes that we already have. We do have a number of staff who are employed in home care management, who began their careers as care workers and progressed through. And we have social workers employed with the Trust as well, who also began their social care career within home care. Indeed, as recently as last week, we were putting forward nominations for the employment-based route for nurse training as well. So I think those, particularly in relation to reach out to our younger people to come into the role, those are the kind of measures that we need to be following. One of the things we do have to be mindful as well, I mean, quite often when we're struggling in relation to accommodating care and looking at our capacity, quite often, whether it's a member of the public or media inquiries, or indeed, colleagues within the organisation may say, well, why don't you go out simply and recruit staff and get them into post? I think we always have to bear in mind is that we need, and we can't be any less discerning about the quality of candidates that we bring in. It's not just about getting the numbers in, it's about getting people with the right skill set. And it is a very challenging role. These individuals tend to be lone workers. They have a high degree of responsibility. And there's a lot of difficulties with the jobs in terms of the nature of the clients that we're dealing with. And therefore we can't lose sight of that. We do need to have you know, the people with the right skill set in order to undertake the role to high standard. Next one, please. Okay, there are a number of other developments that are ongoing that I mentioned in terms of increasing the quality and the accessibility of the home care service across the Western Trust. Already touched on the regional rate, which has been broadly welcomed across the sector. We're already seeing initial benefits from that in terms of sustainability. There will inevitably be a lead-in time from the award of the rate, which was issued to the providers just before Christmas, to enable that to the benefit to filter down in terms of recruitment. We would typically expect sort of a 4 to 6 month period in terms of lead-in time. So we are beginning to see the benefits in relation to sustainability. So hopefully in the weeks and months ahead, we will see better capacity generating from that as well. There is the home care retender and the optimization, which I'll speak about in a second. There's also further developments in terms of integrated care systems, particularly within intermediate care, which is focused on service initiatives, you know, to support the hospital discharge process and also to prevent hospital admissions. You know, issues like rehabilitation and those types of services, which are well progressed across the trust. But home care is only one component part of the whole sort of care and support at home through personalisation and self-directed support. The trust is proportionally ahead of the other 4 trusts in terms of its utilisation of direct payments, where individuals are able to in effect employ they're provided with the resources from the trust to in effect employ their own care staff directly. It's a highly successful scheme. It's not necessarily suited to every service user, but there are certainly significant numbers of service users who work very well in terms of the direct payment scheme as well. And as I say, the Western Trust is proportionately ahead of the other trusts in terms of the uptake of that particular scheme. And then there's the wider regional initiative in terms of the Social Care Fair Work Forum, which was an initiative launched by the Minister last year, I believe, which is looking to sort of establish a panel of experts within the social care arena to look at improving the profile of work in social care, in terms of conditions, the rates of pay, the training and development opportunities, and there's no doubt I suspect that the additional 18 months an hour is very much connected to the thinking evolving from that regional initiative. So those are the just some of the developments which are being undertaken by the trust, but there's 2 in particular. Moving on there, sorry. There's 2. Sorry, next slide here, please. Sorry. Okay, there seems to be a problem slide here, so I so on with that. So can folks hear me okay, or is there maybe a technical hitch here? Hello?
Martin, I think we can hear you. I can hear
Yeah,
you.
we can hear
Yep, we
you.
can hear you.
You can hear me okay? Sorry, I thought there might be a bit technical hitch. Do you want to just take it back a couple of slides there? Sorry. That's it there. Thank you. Okay. The Western Trust is the only trust that has successfully tendered for its independent sector domiciliary care. So the tender and contract was awarded back in 2017 for 3 years, and there was 2 one-year extension options, which the trust has taken use of. The tender has actually expired in 2 of our lots outside of the Derry City Strabane District Council areas in the Valley and in Enniskillen. And in those areas, we've had further contract variations and available an additional year's extension. In terms of the local areas of Waterside, Cityside, Strabane and Castlederrick, we continue to look at our options in terms of how to progress the tender processes in those areas going forward. And we are hopeful that we'll be in a position to announce what our plans are for those areas in the weeks ahead. In terms of the sort of challenges in relation to the tender, I mean, quite a lot of the stakeholders, including the providers, some service users, public representatives, have challenged the trust in terms of, well, you know, given coming out of COVID and all of the other challenges that we have described, you know, it doesn't make sense to progress on with the retender at this particular point in time. The point being is, however, that because of the fact that we have tendered and in line with public contract regulations, we have no option but to progress with the retender. But the tender has been impacted inevitably by COVID. It was also recently, it has also been affected in terms of the timeline by the recent announcement of the regional rate. That has given us cause to reflect in terms of some of the work that we have progressed around the contract adjudication as well as the contract specification, and that means that we're having to sort of further delay the tender for a period in order to consider how that will actually impact our commissioning arrangements going forward. But going forward in terms of Waterside, the contract will expire on the 30th of June, so we will have to have a new arrangement by then in place for Waterside. Cityside will then follow for in November of this year. Castle Ergan, Strabane, early part of that should read 2023 as a type, so apologies for that. But at the same time as being a challenge, the tender does also present us with opportunities to improve, particularly, for example, in hard to reach areas. You know, so we've had the opportunity to reflect on the 5 years of the tender, and we have a lot of learning that we can take from that. The tender has provided us also with a degree of stability to enable us to do further reform, and we'll talk about that in terms of the home care optimization in a second. But the tender also provides us the opportunity to improve the terms and conditions for home care staff, and also in terms of the rates of pay that they receive. And we do anticipate that, you know, on the back of the Minister's announcement of £18 an hour, irrespective of what happens going forward in terms of announcements about regional rates, I think it probably has set a bar in terms of the competitive process for providers in the Western Trust going forward in that respect. Next slide, please. Thank you. And finally, the final slide in terms of the home care optimization. I spoke a second ago in terms of the stability and the foundation that the tender has given us, and it gives us the opportunity to optimize through a process of reform. So the home care optimization project is part of the Trust delivering value work stream, and delivering value is one of the Trust's strategic priorities. What it is, it's the opportunity to consolidate the service within a locality in order to deliver efficiencies. There's a number of ways in which we can deliver those efficiencies. It's not about reducing the service, it's not about cutting services, but it's about consolidating the service. So if we look at it from a perspective within the city, we may, for example, have you know, at the minute we've got 4 providers who provide services in the city, and we may have those 4 separate providers going into, you know, say for example, you know, one particular area in the town, you know, maybe somewhere like, you know, Carn Hill, for example, just by and rather than having 4 separate providers going into one geographic area, if we can cluster the care geographically and locally, we can reduce the travel time where care agencies are passing each other, going from one client to another, and reconstruct that service on a basis of optimizing the efficiency by transferring, in effect, travel time into contact time. As I said previously, it's not about cutting services, it's about matching planned activity to actual activity. So we have got all of the information in terms of what services are being planned, and it's about matching actual activity to planned activity. And in doing so, what we're finding is that we're able to generate the efficiencies that we can translate into additional contacts in terms of additional contact time or new contacts altogether. We can advise that there is provider buy-in to this. We have the 3 providers that we have engaged that operate in the Derry City Strabane District Council area have all expressed a willingness and a keenness to work with us on that, and indeed some have been working with us over the last year in delivering out those efficiencies. And there is a clear evidence of benefit. And just by way of an example of that, we're due to go live with the reformed efficiency within the Fermanagh locality in April of this year. And reflecting back of the 400 individuals that are sitting on or on met need, all of those individuals that sit there currently in the Enniskillen and the Irvinstown localities in the Fermanagh area will be transferred off the unmet need list and on to care within this reformed optimisation programme. So there are clear benefits in delivering greater access to care as well as financial efficiencies as well. So those are the sort of key challenges and the key initiatives that we're progressing in terms of trying to ensure that we continue to provide high quality home care service across the Western Trust, including in the Derry City Strabane District Council area, and that we continue to focus on providing services that are accessible to the local population when they need them. Okay.
Thanking you, Martin, for that comprehensive and detailed presentation. Is there anybody else from the Trust wishing to speak at this time?
No, Chair.
Okay, I'm going to open it up to the floor, but if I could just mention a couple of notifications. People may already have seen them in the chat box. Councillor Edwards, Stephen, is in the meeting. I think he missed the roll call by 5 seconds. And Councillor Maeve O'Neill has put forward a declaration of interest as an employee of Western Health and Social Care Trust. So I already have 3 speakers, folks, and I'm going to maybe take us in 3 or 4 speakers and come back then to yourselves at the Trust if that's okay. Councillor Tierney, Brian.
Thank you, Chair, and thanks to Donna, John, Martin and Oliver for their attendance, and I suppose particularly to Martin for the, as you say, the very detailed and comprehensive report and stepping us through it. I think for myself and for other members, it was extremely useful to have the report in advance, so we could study over it. And throughout the report, Chair, I hope people will agree that Martin has gone on to each section of the role within the domiciliary care team, both in-house and in the independent sector in great detail. And I suppose for many of us has laid out the benefits and the challenges that face that particular team. Throughout the presentation, there was one particular side of it that was resonating with me, and it was always around workforce planning and making sure that the workforce were there. And I think it was slide 3, possibly slide 4, the home care workforce, where it outlines very clearly the 2, I suppose, the benefits of working with the Trust against those within the independent sector. And I think that's very useful. The next slide then talks about the multidisciplinary teams that are in place, and I don't think that there are any in place within the Derry City and Strabane District Council area. I think it's only within, whilst it may be within the Trust, I don't think it's within our council area. The best of my knowledge, and correct me if I'm wrong, I think it's in Limavady. However, that slide also talked about rurality and workforce planning. Martin then touched on fuel and the rising cost of living that people are experiencing in every profession at this particular time. But currently, Chairman, the Trust staff within the community are paid, or sorry, not paid, there's an allowance there of 56 pence per mile for Trust staff. That is capped at 3,500 miles per annum, and it then falls back to a reduced rate. Martin talked about, and I quote him on this, and I'm not in any way suggesting this is down to Martin, by the way, but he said, fuel is a more recent problem. Fuel, in my opinion, has been going up year on year. The last review of the allowances for community staff carried out by the Department of Health and the Trust was in 2014. So 2014, 56 pence per mile may have been a good allowance or a fair allowance, which was capped at 3,500. But I don't think in 2022 with the rising cost of living that it is. And I think there needs to be a review of this particular allowance, and that will feed in to the workforce planning and workforce harmony, in my view, because I have spoken to community nurses and people in the domiciliary care team who are actually having to add money to the allowance that they get to make sure that they can actually go to work. And I think that's a real problem. Then when you take in the rurality side of it, Martin, and there's people on this call who will be able to give a better geographical explanation on this than me. I'm unapologetically a city boy, but if you're in Castlederg and you're trumping between Plum Bridge and Aheyarn and everywhere in between, it's not going to be very long until you've clocked up 3,500 business miles, and then you revert back to the lower rate. And if there's anybody on the call, could they please inform us what the lower rate is? Because I've been trying to find it out, and there's very, very few people that actually know what it is. That's one thing, one small thing in terms of workforce planning and workforce harmony that I think the Trust with the Department of Health could do to try and make sure that they're attracting people and keeping people within this role. You know, Martin has talked about the age range, or the average age range between the independent sector and the Trust. And again, you know, it says I think it points out very clearly that the independent sector are catching a younger age category. And again, that would have to be asked why. And I understand as well, when we talk about the mileage and stuff like that, that some of the independent sectors don't actually pay a mileage, but they're allowing their rate per hour, I think, incorporates that. There's no doubt, in my view, that this is a very, very valuable service. But for it to be a valuable service, it's at the cold face where it's going to be most valuable to patients and to their families. And if you don't have staff who are content, to say the very least, that going into a community role is going to benefit them and their career, then I don't see how you're going to push this domiciliary care on. I do genuinely believe that a review of allowances for community staff needs to be carried out, because, as I say, 2014 since the last one, and I think that's something that has to be reviewed. There's no doubt there is evidence within the report, Chair, that points out very clearly how valuable this service is, but I just think it could be slightly better. And those are the challenges and the things that certainly that have been raised with me over this last number of days whenever we see the increase in fuel prices across everywhere. And it's one of the challenges. But there's just a few wee questions there, if Martin could, or someone could answer them. And before I close, I meant to do this at the start. I need to declare an interest, because I'm an elected member of the LCG on behalf of for the Western Trust. So I just did declare that interest as well. But thanks very much for your presentation, folks. Thank you.
Councillor Logue, Patricia.
Thank you, Chair. Sorry. Thanks, Chair, for letting me in. I'm not part of this committee, but first of all, Martin, I just want to thank you for your presentation. It certainly was interesting, but I suppose a lot of it is not new to us. We are very aware of the many challenges that are providing home care services at the moment. And I know previous Councillor Tierney spoke about the travel arrangement, the travel allowance and stuff like that, and that is another worrying concern. And I know maybe the Trust can look at that. However, you did say in your presentation that the private service providers, the 7 private service providers, they have a mixed bag of what they offer their workforce. Now, and I do think therein lies the problem. It is the terms and conditions that are offered by these private providers to the workforce, it is evident to see by the turnover of staff and the intervention that the health minister had in mind to enhance the staff retention, that there's obvious problems within the terms and conditions. And, you know, I do think that the trust do now have an opportunity to do something about this with the renewal of the contracts. It shouldn't be all about cost. I think in the contracts to ensure that the services are being provided in an equitable and manner, and that people who are providing those services, the workforce, are treated right, that the trusts need to ensure that whoever they award these tenders to, that they are have a good track record, that their pay terms and conditions are good, that it's not just zero or contracts. There needs to be across the board looking at the whole expenses for mileage, etc., and room for an enhancement whenever these critical world crisis things does occur. To keep the service going, people need to be recompensed for that. So I do think the trust have an opportunity, and they need to be taking it, looking at their tender process and really scrutinising the applicants that come in to provide these tenders, that they are creating the right terms and conditions for their workforce. That's why the turnover is, because of the terms and conditions. But I just wanted to say that I do think that is very, very important. But Martin, you did mention too that the trust, the Western Trust in particular, was doing particularly well regarding the direct payments. Look, I'm not going to mention anybody's names here, but at the minute I am working with a few very, very distraught constituents who have been getting services from the trust, and then all of a sudden they were told, no, you have to go and take direct payments. That is not true. I have been reading up on all your legislation regarding the direct payments. If the trust do not feel that you can manage it, or if it's not right for you, then you do not have to take it. And, you know, but however, that's not how it's rolling out in the ground. And I do know that people have been left without services. And the direct payments, they are being given booklets, which I would have to read about 3 or 4 times to try and get my head around, to understand how to do this. They are the people that I have been in touch with have not been given the appropriate help in order to even set up these direct payments if they so wish, but yet their service has been taken away. And for me, that's totally wrong. There is an issue, and I do have a letter half ready to go to the trust, because I have been working on a number of issues on a few months now, and I have to end up going and writing this letter. Look, I don't want to hold the meeting by this, but I do think that if I'm getting a couple of issues regarding direct payments, there's many people out there who probably have got the same, and it's not working for people. There is something wrong when clients are told that they must take this, they must do this. In the middle of a pandemic, services were taken away in 2021. Who in under God made that decision? Where they stop a service in the middle of a pandemic? were people who were ill, who needed the service, who had got letters from the health department to stay at home, and they couldn't go out anyway to open bank accounts, etc., etc. It was just a mad decision anyway in the middle of a pandemic. But that's another. We will get to the bottom of that. Oh, there was just one other thing in your slide there, Martin. It was near the end, and I think it was the second bullet point down, where it said deconstruct to reconstruct. I would say reconstruct and then deconstruct. I think that's totally the wrong way about, because for me, there has been a deconstruction of services to certain people before the reconstruct was put in place. So I think those two words need to be changed about. Martin, look, I know you all on the line here, you all have a very difficult, challenging job, and we would like to assist and help in any way that we can. And I do hope that, you know, maybe a nod comment that we might make may help yourselves in the trust to make this service the best that it can be. But thank you very much for coming on to present to us today. Thank you.
Thank you, Patricia. Just a note that John McGarvey had to go on and gives his apologies. Martin, I'm going to take two more councillors, and then I'm going to come back to yourselves, and then there's 4 further speakers. So if we can take 2 more. And the next is Councillor O'Neill Maeve.
Thank you, Chair, and thanks to Donna and John and Martin and Oliver for their attendance at the meeting today, and Martin for your presentation. I'm just going to start with what I think is the most important slide, Martin, that you presented, just around the comparison between the workforce that are part of the Health and Social Care Trust and the workforce that is part of the independent sector. And I think like that slide in itself was very, very striking, and in particular the staff turnover. And I think this has everything to do about the terms and conditions that the staff in the independent sector have. Whenever like Councillor Tierney there was talking about the fuel payments and stuff for our health and social care staff. However, staff in the independent sector and for many organisations don't get paid for their petrol money at all. Staff don't get paid for the time that they spend between house to house. They only get paid for the time that they're in somebody's house. And I have colleagues who now work for the trust who've informed me of this, and there's other people who've told me about their terrible terms and conditions. And the difficulty is that in the independent sector there's very poor trade union representation. And I think it was very disappointing that whenever the minister, in tackling the social care crisis that we're facing, whenever he only gave a pay uplift to the independent sector staff, I had asked at a previous meeting, was there any thoughts or moves to increase the number of home care and domiciliary care staff that the trust employs? And that wasn't in the plan at all to address this crisis. And I think the Western Health and Social Care Trust is a good employer. They work closely with trade unions through staff side, and the terms and conditions, they're not perfect, but they're very, very good. And when there is a difficulty such as the one that Councillor Tierney has described, trade unions work with HR and staff to actually improve those terms and conditions. There's actually a vehicle for change there, but when you're in the independent sector, you've nothing. The only way to change things is by changing jobs, and that's why the high turnover exists. And I suppose like my first question to yourselves is, how, do we have a position on increasing the number of domiciliary care staff and social care staff that the trust employs? I know that is probably entirely dependent on funding that comes from the health minister. And do we as a council need to write to the health minister to say we support bringing social care back into public control, because at the end of the day, it's only been recently privatized in the last few decades. We need to bring it back under public control so that these staff, so that there's a lower staff turnover, better terms and conditions for staff, and that we can actually properly have a public service solution to addressing the social care crisis. So I just want to hear your thoughts on that, if that's okay. Just a second point around the increased fuel costs again. I know that the trust have a car lease policy and things as well, and I think again that presents a very good opportunity around electric car usage and stuff. So I don't know, is the trust looking at within their car lease scheme bringing in electric cars for staff, because I think that could be a very, very positive move, which for staff who work for the trust, if they then had that accessible access to electric vehicles, then it means then they're more protected around the fuel crisis and increase in fuel that we're currently facing. I think the point that's most important of all is the service users, is the people that the social care service serves. And unfortunately, it feels like the people that we're letting down a wee bit at the moment because of the crisis that we're in. And I am an employee of the Western Health and Social Care Trust, and I know that this crisis in social care impacts the hospital turnover. So it doesn't just affect people who are requiring domiciliary care at home, but it impacts the flow of the hospital, and it has so many other implications. And Councillor Tierney had said that this is valuable work, but this is essential work. The job that these workers do is absolutely essential, and they do an incredible job. They enable people to not only stay at home and live at home, which costs the state less, but also they enable people to live independently. And I think the reablement service is an excellent example of what the trust can do and deliver, which is a multidisciplinary service. And I think I think we really need to put them front and foremost of everything that we do. And with that in mind, Martin, you talked about the home care optimization, and yeah, there's provider buy-in, great stuff. But what have service users said about this home care optimization plan? Because I know that there's fears among service users around the variability in care. If you think about the service, you have people coming into your own home and helping you with your personal care needs. Whenever there's a high turnover and there's a lot of different people, and you build up a relationship with with these workers, and whenever they change, it really does have a massive impact on the people that we serve. And I'm just wondering, what are service users saying about this, and how are we engaging service users in any service change that we're making? And then with regards to home care optimization as well, what has been the trade union feedback on this also? And just lastly, on the tender, so that's very interesting. I think putting better terms and conditions into the tender process, yeah, definitely is an interim measure for the independent sector. I think that's great that if that can be done, but I think ultimately we really need to expand the health and social care trusts number of domiciliary care workers, rather than continuing to outsource that care to the independent sector. But thank you so much for your time. I think this is a really, really important issue, and it's great that we're getting the opportunity to discuss it today. So thank you.
Thank you, Maeve. And one further speaker for now, and then I'll come back to yourselves, folks. Alderman Devaney Morris.
Thank you, Chair, for allowing me in, and can I just say a warm welcome to everyone to our committee here. And I've listened to a very, very detailed presentation and around domiciliary care and around that. I do take on board the difficulties at the moment going through the pandemic. It has been a difficult time for everyone and all health services or care workers or whatever it may be. And look, we must commend everyone who worked through that and the great work that they've done. I do take on board the issue and around we're a population of where people are living longer now, and that creates its own challenges and around higher demand for services. And I do take on board as well the rural challenges. And I think, Martin, you said that maybe aren't as bad in our council area as they are in some others. And around the skill set, I think it's important that we have a good skill set in there. But that comes along with, keeping that good skill set there as in around a good, decent salary. And look, I've listened to concerns in around travel for mileage, 56p for the first 3,500, and then it drops in a considerable drop, way over 50% down to 23 pence per mile. And I think when we look at the rising cost of living and the rising cost of fuel, as I think one of the previous speakers, if you're leaving Plumbridge to come to Donamana, maybe to Ardagaravan or to Strabane, you're not long clocking up some mileage. And look, when you look at the cost of fuel back in 2013, the car I'm driving about or new then, it was 35. It was around about £30 to fill the car. For to fill the same car today, it cost almost £90 to fill her. So we can understand and around the mileage there. And I do believe that, look, we should have plenty of workforce planning and harmony. And I do have concerns about the turnover because probably that harmony isn't there. And when people are working in conditions with very high cost of living and stuff like that, there, if they see another alternative with a higher salary, they're quite rightly move on to another job. And we do have, if domiciliary care isn't working, it upsets and causes concerns within the hospital setting, because when you have patients that are ready for home, doctors and hospitals have said they're ready for home, and they have to be maintained in the hospital for maybe quite a number of days, maybe weeks at times, until a care package is put in place. It does, and I have dealt with quite a number of those instances where people were looking to get out of hospital and there was no care packages available, and it took quite a bit of time. And I do believe that puts a lot of stress under the health services within the hospital setting. But look, there are plenty of concerns there, and I'm sure there'll be more raised. But thank you very much for the presentation. Thanks, Chair.
Thank you, Morris. And coming back to yourselves, folks, Martin.
You're on mute, Martin.
Apologies, folks. Common mistake I always make. No, as I say, or I was attempting to say there, thanks for the comments and for some of the questions. So if I maybe just take the opportunity to pick off one by one, starting with Councillor Tierney, who had raised the issue around fuel. It's certainly an issue that we are acutely aware of. We have escalated it through to senior level within the organisation, up through to our Chief Executive's office. It is also an issue that we're acutely aware regionally, and I know it's an issue that both the department and the Health and Social Care Board are working to attempt to resolve, and we're waiting for some feedback from them in relation to whatever progress can be made. So I think it would be safe to say that certainly within the trust, we're doing everything we can to try and lobby on behalf of our staff to ensure that the whatever consideration can be given to help to alleviate the issue around fuel can be provided with. In terms of Councillor Logue, the issue in relation to the terms and conditions within the independent sector, I think what we could say is that the award of the rate increase to £18 an hour reflects roughly about £4 an hour additionality for each of our local independent sector providers. That was provided very recently. It was only just before Christmas that that had been provided. It's provided on the basis that it is passed on to the frontline staff, and we will be doing whatever we can to ensure and to monitor that that is the case. We are already seeing some degree of stability coming into the marketplace and on the back of that, and that we're hoping that that will sort of materialise in terms of ongoing and better terms and conditions and rates of pay for the employees within the independent sector going forward. In terms of the comment in relation to direct payments, obviously we're not able to sort of discuss that in terms of individual cases, but I do note that your intention to write to the trust, and certainly we would welcome that and undertake to investigate whatever particular issues from your constituents that are actually raised. Just a tiny bit of clarification in terms of the comment around having to deconstruct to reconstruct. In effect, what the point I'm trying to make there, Councillor Rogue, is to I made a point is that prior to the tendering of domiciliary care, we had a very sort of fragmented arrangement that had grown up over a period of about 20 years in terms of the independent sector domiciliary care. By putting it into the contract in the first instance, gave us the foundation and the structure to move on to further improvement. So it's simply about, in terms of the deconstruction, what we're taking is just paring it back to its basics and reconstructing it on the basis of a much more methodical service delivery arrangement, consolidated around localized areas in order to ensure that the service was much more manageable in terms of its delivery. And so hopefully that provides a little bit of clarity around that. In terms of the comments from Councillor O'Neill, again, issues around in terms of funding, and hopefully that the benefit of the additional funding that's been provided to the sector will filter through and help to narrow the gap between what is paid by the trust in terms of its rates of pay and terms and conditions and our independent sector colleagues. You're absolutely right in what you say in terms of that there is the car leasing scheme is available to staff who are employed by the trust, but it would be up to the individual staff member to pursue whatever particular type of car, and there is the opportunity to pursue much more environmentally friendly sort of options in that respect. And finally, in relation to engagement with the service users in terms of home care optimization, we do understand and fully accept for some staff this can mean a change, and it can mean an element of upheaval for individual cases. We manage them carefully alongside our social work colleagues to do so. We engage with the social work teams, with the individuals involved, and we try to ensure whatever disruption that may be caused is kept to an absolute minimum. But we also look at it from a wider perspective. And I touched on the number of new service users who will actually be able to be accommodated as a result of the change and beginning to address that unmet need. So I think we certainly look at it from a sort of greater good perspective in terms of trying to increase accessibility to our service for more people. And we do understand and accept that that might have some sort of impact on individuals, but we work very closely with those individuals and with their social workers to ensure that any disruption is kept to a minimum. And similarly, thanks to Alderman Penny for his comments as well in relation to the work that we're doing in relation to trying to address issues around rurality and in the areas, and recognising the impact that travel and the increased fuel costs are having there. And certainly we appreciate the comments in relation to reiterating the impact that a good, sound, robust domiciliary care service has in terms of supporting our hospital colleagues, particularly in relation to discharge and length of stays and issues around that. So hopefully that addresses sort of the key issues that councillors have raised thus far.
Thank you, Martin. Thank you very much. And just to say, obviously signifies the importance of this issue. We've another 6 speakers, Martin, so we'll work our way through that. And just to let the speakers know what order they're coming in, of Councillors Boyle, Gallagher, Farrell, Harkin, Alderman Kerrigan, and Councillor Ferguson. So, Michaela, please.
Yeah, thank you, Chair, and thank you, Martin, Donna, John and Oliver for taking the time to come to speak to us this afternoon. Again, like others, I want to commend the great work that our carers do on a daily basis right across our city and district, you know, and they do it in the most challenging times, and obviously our weather conditions as well, particularly in the rural areas. But I don't want to go over old ground and what's already been discussed, but I did make a promise to one care that I would raise an issue today. It has been raised in terms of fuel increase, but just to give you an example, Martin, I got a call during the week from a lady who, young lady, she's in the private sector, she's a domiciliary care worker. There are 4 members, including herself, of her family, her family circle, who are who care in the community, but because of the rurality and where they live and the distances that they have to go every day to meet the need and to care for their clients, obviously, I've been hearing that they have to look now at the future of their work that they're doing. The girl told me that her aunt is thinking of going back into the care setting. Her mother is actually given up, and her cousin is thinking in the same line as her, maybe doing a sitting service or something like that, because it's just not paying them in terms of the fuel and the cost of it. Obviously the wear and tear of their car and all of that, but I know we did discuss those issues, but I just wanted I gave a promise that I would raise it here today. Others also raised the issue in terms of, and it's on your presentation, the increasing complexity of cases in terms of older people specifically. And may have talked about the excellent reablement services and the integrated services we have for people coming out of hospital. I just want to kind of just get a wee bit of clarity on that. I have been involved with a family who needed a step down package, and in terms of the discharge plan, and the multidisciplinary team were working with that family, trying to meet the needs for the family. But part of the problem is the family caring for their elderly mother. They all work. She was getting the cares in the morning and the afternoon, but that there was a gap in the evening time. And I just want to know, in terms of someone coming out of hospital, now the most important for me, I suppose, is morning and afternoon, making sure that that person's safe, getting to bed and getting prepared and that kind of thing. But the family were looking for some sort of a sitting service, just to kind of plug the gap to the family came home from work and were able to go and see the needs of their mother. But because they live in a rural area, that service is not being met. I think we have significant opportunities in terms of untapped potential within our communities to increase the demand for sitting services coming out of hospital, and obviously the reablement services, and in terms of the roadmap that they prepare for families. Are there any options there that we could do better in that regard for families who have parents coming out of hospital or relatives that need that care, between the days and the times that it's not there, that those gaps need plugged. And as I said, I think we have potential within our communities to do better in this regard. Families are struggling to help their loved ones when they do come out of hospital, because that's what they tell us, that care in the community is about, funding it and providing it, but it's just not there for everybody, I suppose, is what I'm trying to say. But how we can do better in terms of that, particularly in the rural areas, because that's where I'm hearing that it's worse. The urban areas like in Derry City and other places have better provision of sitting services and that, but we don't have it in the rural areas. So how can we move forward with that? So thank you, and I appreciate the opportunity, Chair, to speak today.
Thanking you, Michaela. Councillor Gallagher, Paul.
Thank you, Chair, for letting us in. And like others, just thanks for the presentation. Hi, and look, and it's just to say, we can argue about the real big issues and the wider issues, and some of it may be beyond the control of the people that's on this. But just for to say, and others have that there, we as councillors play a very important role, and some of the contributions that we can make, on the one-to-one basis, I think are positive, and engaging with the trust. I had a serious issue last week that was quickly resolved through good communications with Oliver, which I very much appreciated, and it was resolved very quickly. So what I was just looking to say, and obviously thank Oliver for that, is to have good lines of communications open between the trust and elected reps on those. Sometimes they can be very serious for families and individuals on the one-to-one basis that we can resolve together collectively with good lines of communication. So if we have that going, I think we can, the stuff that's happening on the ground, we can resolve with everybody's benefit. So I'd just like to say that, and thanks everybody for being on the call.
Thank you, Paul. Councillor Farrell, Rory.
Thanks, Chair, and thanks, Martin, Donna, John and Oliver for the presentation today. And obviously, thank you and thanks to your teams in-house and in the independent sector for the help, care and support that they provide to citizens right across this city and district on a daily and nightly basis. I want to just touch on complex discharges from hospitals. There is a target that 90% of people should be discharged within 48 hours, and the current outcome is 83%. And there's a target that nobody should wait longer than a week to be discharged, and we're currently at 91% on that. And the number one reason for a delayed discharge is lack of a domiciliary care package. And I note the ever-increasing demand on services. I note the innovative solutions, regarding enhanced pay and enhanced terms and conditions. But I've got a very, very simple question. How many vacancies exist in the Western Trust area, in-house and in the independent sector? Because it hasn't been touched on. We've spoken about the challenges, we've spoken about the solutions, but we haven't said, where the gaps are, how many vacancies there are, because clearly there are if people can't get discharged from hospital in time. Thank you.
Thank you, Rory. Councillor Harkin, Sean.
Thanks, Chair, and thank you for the very helpful presentations and the document that went along with it as well. And I think it's extremely helpful for us to get as much of a real insight into, the work that our health workers are carrying out, or that our health providers are carrying out, because it's, as everybody knows, it's, there's been tremendous strain recently, and that doesn't look like it's going to ease anytime soon. I think, look, from my point of view, I think that domiciliary care workers, both in the trust and in the private or independent sector, do work that is extremely valuable to our society. I mean, they work with some of the most vulnerable in our society, and they work very, very hard. And I think, as everybody has acknowledged here today, the vast majority of those workers are not being treated fairly and are not being treated properly, and are not the value of their work isn't reflected in their pay and terms and conditions. And obviously there is we've acknowledged that there's a big difference between workers in the domiciliary care workers in the trust and domiciliary care workers in the independent sector. But even in the trust, for example, it can be a lot better. And I know that all the big parties have been on here today talking in terms of their concern for the treatment of workers. But, at the end of the day, Stormont went along with a Tory 3% pay, real terms pay cut that's been imposed, and that is way below inflation, and that is not going to help our exhausted and overwhelmed and frustrated trust staff. So I think that's just, that's the problem. It's like we hear these claps, but then the reality is, people are not feeling that their work is being properly acknowledged and respected, and then reflected in how they are paid. And that's very true as well, as we know, for the independent sector. So, what jumped out at me as well, and Councillor O'Neill mentioned this, was the number of workers now that are in the independent sector. And there's been an ongoing call to expand the trust, to expand to bring in those domiciliary care workers into the trust in order to raise up the terms and conditions. I mean, that is the easy solution. So a question has to arise: why is that not happening? And look, again, the independent private sector didn't just happen. I mean, this is something that was politically engineered by Tories, but also by Stormont. That doesn't just happen. And the idea was that the private sector can do this more efficiently if there's competition, and that hasn't been the case. It's actually backfired, because the work of the trust and the skill of workers in the trust is still superior, I would argue, to what exists in the independent sector. And that has to be acknowledged. So if we keep raising up the standards in the independent sector to the level of the trust, there isn't really an argument to have that independent sector. It should all be one and done on a not-for-profit basis. I don't think domiciliary care should be a for-profit business, and that's at the heart of this problem. That is why terms and conditions are worse in that sector. That is why there had to be a massive intervention by the health minister during the pandemic, because of atrocious terms and conditions for workers. And when you have atrocious terms and conditions for workers, that then has a knock-on impact then on the people that they are trying to care for. That it's a measure really of how we value the people that they're caring for as well. So look, so for us, that these things are tied together, and we can focus in on some of the minutiae, but I think we have to tackle the bigger issues. Again, we talk about terms and conditions for workers in the private sector. Stormont just voted against the majority of the Stormont executive parties just voted against a bill last week that would have actually made it easier for workers to join a union, that would have made it easier for workers to campaign for higher wages, that would have made it easier for workers who are in the trust and in the independent sector to stand together for better terms and conditions. So look, there's a lot of waffle here, and that's how I would describe it. A big gap between what people talk about in terms of their concerns for workers and the reality of what's getting voted for up in Stormont. I will, Councillor O'Neill did say we should write to and call on the health minister again to have a strategy around bringing domiciliary care workers into the trust. So I'm going to put that forward as a proposal that we do that. Thank you, Chair.
Thank you, Sean. Martin, I have two further speakers. I'm going to take them now and come back to yourselves, and then obviously at the end we'll look at the proposal. Alderman Kerrigan, Keith.
Thank you very much, Chair, for allowing me in. And I do thank the speakers for their comments there. And again, I know that there's a great bit of work that is being done. And as I say, we're not seeking to find fault or anything in that regard. But I sort of was touching on, and again, the points that Councillor Tierney had raised at the start in regards to mileage. And I know that's more than likely outside of the remit and the control there of the officers here on present. But it's 56 pence a mile for the mileage for the staff there. It's grand, maybe for those that are based maybe within the city, those that actually aren't putting up much miles, they're doing care in the community, but actually doing mileage. I mean, I have a lady there, and she did work through the health service, and she's working now for a private firm doing care in the community, and it's in the rural area, it's in the Castleberg area, so it's our clients out, and it's very rural. And I mean, last year, because she came to me and I'd assisted her, she'd done almost 22,000 miles. Now, when you're factoring that in there, you know, if she was on under the health service rules here, she would be able to claim a business expense there of £5,628, whereby under the HMRC guidelines, which is what she's working on, at £7,460. When you're putting it down to pounds and pence, she's £366.40 better off being in the private sector for her mileage than if she was in through the health sector. You know, so I mean, you know, I see it as a figure here. As far as I see, it's 56 pence for the first 3,500 miles, and as far as what I've been looking at here, it's 20p. I don't see it. I see someone put in the chat there, it's 23 pence. I don't see that when I'm going through that. I've looked through various bits and pieces. I've looked, even I found an answer from Michelle O'Neill when she was health minister stating it was 20 pence. So I've looked through various things there while I've been online here as well, trying to find an up-to-date figure, but I'm still hitting 20p. Maybe I'm wrong here, but you know, whereby it's 45p for the first 10,000 miles and 25 after that. Sorry, I see. Thank you, Donna, for clarifying that there. I see that up there. So, you know, it's roughly 5,000 miles. Once you clear the 5,000 mile mark, it's better off, according to the HMRC guidelines, for your mileage allowance rather than what's being paid through the health sector or through this here. So it's as I say, it may well be handier when you're not traveling big miles, but particularly for the rural end, it is a major factor, I would be minded. And again, I've asked the question, even asked that question to this lady in particular, and I've had 3 different ladies there have contacted me in regards to their mileage claims. And I know there was a major issue as well. I suppose we were all caught on it in regards to the COVID legislation, whereby, you know, there would have been 2 carers going to house, and they each had to take their individual, they each had to take their own car, whereby prior to COVID, they'd have been going together and I suppose sharing that mileage between them. You know, so I mean, that was a factor as well, whereby you'd other ladies that were 10,000-11,000 miles, whereby that they said, you know, we'd only been coming in about 6, you know, other years, but it's just so it's those factors there. But no, as I say, I thank you for the report. And again, I know that's probably outside your remit, but it's one we're going to have to push as much as possible, because with the increases in fuel there, you know, it's taken any good out of it that ones would have got. But no, that's just a few comments. Thank you very much, Chair, for that, man.
Thank you, Keith. Alderman Ferguson, Rachel.
Thank you, Chair, and thank you to Donna, John, Martin and Oliver for presenting here today. And I promise I won't keep you too long. I know you are extremely busy and you have a really important role. I want to start off by saying thank you to all the care workers for the work they do, you know, especially the domiciliary care workers, because it does give people that independence to stay within their home. My question, a lot of the stuff has been kind of questioned anyway, but my question kind of follows on from Councillor Farrell's. I had a case in particular here in our city and district where a young person had come forward to say they'd moved back here in August and they'd been trying to get their care package, which was a day and night care package, but there wasn't any staff or resources available. And unfortunately that was the same until the 1st of March there. And then the social worker was able to provide a care package that obviously left that individual very vulnerable and struggling with their own independence in their home. I know this is a case that has been resolved, so appreciative of that, but I'm just wondering, with the workforce plan and with the gaps and the vacancies, how many people are currently waiting at home for a care package? What are we looking at to get these resources kind of back up and running? I know it's a job that requires great people who really care and a lot of travel, and I know it can be challenging at times. I'm just wondering, throughout this whole presentation, I'd seen that there has been improvements with the pay increase in the independent sector, and I do have concerns that there are what, a quarter of in-house staff and versus the independent sector. I'm just wondering if you would have that figure or know that figure of how many people who are currently at home, not in hospital, but home awaiting their care package, and whether or not this will be sorted now with the enhanced pay. Thank you.
Thank you, Rachel. And Martin, if we could come back to yourselves in regards to the last 6 speakers, please.
Yeah, sure. Donna, are you happy for me to continue to pick up in those? Or?
Yes, please, and then I'll come in just to the end. Thank you.
Okay, no problem. Again, obviously, I mean, fuel is a recurring issue from most of the councillors' contributions. So again, just to reiterate that, you know, it is an issue that we are extremely mindful of. We have escalated both within the organisation and outside, and we will continue to treat it as a priority. We're very aware of the impact that it has. I think Councillor Boyle made reference to sort of issues around again, sort of complexity and the benefit of reablement and issues around capacity, and in particular in relation to the development of particular setting services within the locality. And again, we continue to sort of follow the process that are well established in terms of the individual assessment, the availability of care, and looking at whatever gaps there are, and then looking at what ways that those gaps, you know, can be explored. I did mention in the presentation the availability of direct payments, and that's often a source that people pursue to look at setting services, and that may or may not be suited to that individual. But if there is a gap in services in relation to that type of service, there is the opportunity to explore that through a service development process as appropriate. Again, in terms of Councillor Gallagher particularly made reference to the sort of lines of communication and the positive sort of experience that he had with Oliver, and we recognise that. Councillor Farrell specifically sort of questioned the number of vacancies that exist between the in-house service and the independent sector. Unfortunately, I don't have that information at hand, although I will undertake to get it, and I'll communicate that via Oliver back into the council to provide clarity, and just in terms of what the actual position in terms of vacant posts, both within the trust and within the independent sector, and I'll undertake to do that in a timely manner. And in response to Councillor Harkin's issues in relation to the role of the in-house service and looking to expand that role, just to reassure Councillor Harkin that the trust continues to be very committed to the in-house service. We'll look to ensure that it continues to have a significant presence in terms of developing and delivering the domiciliary care services across the Western Trust area. And of course, we will continue to be guided by the strategic decisions that are made by both the Department of Health and the Health and Social Care Board in terms of how we continue to deliver our services into the future. And again, Alderman Kerrigan making reference to issues around fuel and mileage. It is my understanding, and there is a bit of sort of confusion around the lower rate to the standard rate in terms of after 3,000 miles and whether it's 20 or 23 pence. Again, it's my understanding it's 23 pence. I can stand corrected, but again, similar to the point, I'll seek clarification from our HR colleagues, and through Oliver will communicate to the council in terms of what the specific arrangements are in that respect. And in terms of Councillor Ferguson, in terms of, again, looking at the whole issues around the care planning and the issue that was resolved, and again, just sort of making the point in terms of, you know, the processes in terms of the assessment of need, the identification of need, and trying to ensure that, you know, wherever possible, whatever measures we can do to ensure that we can free up that capacity to meet that need in a more timely manner. Made reference to the process of optimization, and that's one of the key issues that we are sort of progressing to address that unmet need. To answer the question that was asked in relation to how many of those people are at home, there's on or around 400 people currently logged as unmet need. The overwhelming majority of those remain at home. There are a number of individuals currently in hospital. Again, I don't have the figure off the top of my head, but I'm going to suggest it probably will be no more than 30 individuals across the trust at this point in time who are waiting in hospital for a care package. So those individuals who are waiting for a care package, overwhelmingly in number, are at home. And it's through the whole process of optimization, but we also do have a dedicated resource who on a daily basis reviews those individual cases, links with the social work teams, links with the independent sector providers, and we do have what we term a brokerage department, which is a continuous link with our providers to ensure that these cases are consistently and continuously reviewed. And the point we make is that the unmet need, we made reference to the fact that there were over 2,200 new referrals within domiciliary care this year. That is very much a sort of a dynamic situation where a lot of the unmet need does get met from day to day, but as one goes off, another one is coming on. So it's constantly reviewed, and we do have successes in meeting those unmet need. But the point that I made earlier on in the presentation, there is a real challenge around the increasing demand for the service and our ability to supply it, and that's why the whole issue around optimization and workforce planning is critical in terms of ensuring that we're able to meet the needs of the population going forward. So I think and I hope that I've addressed the main issues that the councillors had raised there in their questions.
Martin,
Martin.
thanking you, Martin, and if I could, on behalf of the committee, thank yourself, Donna, Oliver and John for your time today and for, as I say, a comprehensive and detailed presentation, and also the work behind it and the work of all our carers on a daily and nightly basis. So if I could thank you on behalf of the committee. And if I could also say to these folks, the meeting will continue on YouTube, which you're more than welcome to, but at this point, the WebEx connection will be taken down. That's okay.
Thank you, Chair. Thank you, Chair. And just thank you for the opportunity to give you an update on domiciliary care and for the Council's genuine interest in domiciliary care for the people that we all serve together. And I think one of our main points going forward is that good and open communication between yourselves. And I think that's very helpful. It can only be of benefit to your people that we all serve. And just for one point of clarity, it's just around the agenda for change sets the rate for pay, but it is something then that we would, it's not set by our trust, which I'm sure you're aware of. But we want to just thank you very much for your genuine interest today.
Thank you, folks. Thank you.
Bye-bye. Thank you.
Thanks all. Bye.
Bye-bye.
Okay, members, I have a proposal on the floor from Councillor Harkin. Can I have a seconder, please?
I'll second it there. Councillor
Okay.
McGinley.
Thank you. Anybody wish to speak to it? Okay, folks, the proposal proposed by Councillor Harkin, seconded by Councillor McGinley. Unless I hear anybody to the contrary, I want to take it as accepted. Thanking you. Okay, folks, moving on to item 6, chairperson's business, and there's 2 items. One from myself on behalf of another councillor, and it's just to ask for an update on the motion which was passed in recent times around over 65s and the use of leisure facilities, council leisure facilities. And I've already spoken to Barry, so if we could ask Barry, please. Thank you.
Thanks, Chair. Chair, we were planning to bring an update report to committee next month on it. We have compiled the EQAA responses, but I think rather than bringing the report in cold, it might be a good idea in the next number of months to have an elected members briefing, similar to we've had in other projects, so we can go into the detail around all of that and appraise members of what we presently provide over 65. Most members will be aware that all swim and health, sweet and showering facilities are already free. So just to outline exactly what this proposal would mean and mean for council income and also for other groups, that we would have, there would be an expectation we provide that assurance to those groups as well. So if members are content, we would propose maybe an elected members briefing on this particular issue.
Okay, folks. Thanking you, Barry. The second item, if I could ask Councillor Lillian Samoy, please.
Thank you, Chair. We are bringing a proposal together with Councillor Sean Hacking. Through you, Chair, can I ask Councillor Sean Hacking first to speak?
Councillor Harkin.
Thank you, Chair. Thanks, Lillian. Look, we have a proposal that we're going to put in the chat box there. I've also included a link to the upcoming event, which isn't part of the motion, but so people can have a quick look at it if they haven't already seen it. Look, the March 21st is the International Day for the Elimination of Racial Discrimination, and it's an important date around the world. Our council, as we know, have passed some very, very strong motions in recent years, taking a stand against racism, reaching out to organisations across our district and across the island that are campaigning against all forms of racial discrimination. I think because of the Black Lives Matter movement and the kind of fallout of all that, I think we've a much better insight now as to our Black and minority ethnic community space here and right across the island. So there's an action being held on March 21st at the Lifford-Strabane border, and the action is calling for a change to the common travel area regulations. Right now, those regulations allow free movement for most people, but they don't allow free movement for all people. And the regulations have a very negative impact right now on refugees, on migrant workers, on asylum seekers, and in particular on the Black and minority ethnic community on either side of the border. So this is really a campaign that's been ongoing to change the common travel area rules to basically end what is a hard border for people of colour here, which has been here for a long, long time. That campaign is growing in strength now. There's many different organisations involved in it, and I think that I think our council should give its support to this campaign and endorse the International Day of Action. And if people can see the motion there, I think it's something that's very much in line with decisions and motions that our council has backed before. And look, this is happening in the context of what we're seeing in Ukraine with, 1.5 million people fleeing their homes. And I think that is put into a very bold and bright, it's really underlined, the role that borders play and the need to kind of get rid of red tape, get rid of barriers that don't allow us to help people who are fleeing war, fleeing persecution, and looking for safety and looking for a refuge and looking for a place where they can flourish and survive and where their families can survive and flourish as well. So I think in that context, I think this is a way for us to take action here in our district area and to send a message about our solidarity with migrants, refugees, and others here on this island, but also across the world. Thank you, Chair.
Thank you, Sean. And just a notification there, folks, from Councillor Lillian Seymour Barr in terms of a declaration of interest, Director of Programs at the Northwest Migrants Forum. Councillor Barr, Lillian.
Chair, thank you once again for letting me in. And as you know, I am the Director of Programs at the Northwest Migrants Forum. So before I make my remarks, I would like to record my thanks to Councillor Sean Harkin for agreeing to work with us from the Northwest Migrants Forum on this particular issue. Chair, the International Day for Elimination of Racial Discrimination is held on the 21st of March every year. The event is held on this day because on the 21st of March 1960, police opened fire and killed 69 people at a peaceful demonstration in Shepville, South Africa, against the apartheid pass laws. Now, pass laws were an international passport system that was designed by the South African government to prevent the freedom of movement of Black people. This controlled where people could work, live, and travel inside the country. And while it is really important to recognize the amazing work that has been done throughout the world to put an end to racism, we cannot ignore facts. There are hundreds of thousands of people with legal rights to live and work on the island of Ireland, but are denied rights to move freely. The Common Travel Area Agreement is no different from apartheid pass laws in that, in truth, only British and Irish citizens can exercise free movement within and between these islands. Those with legal rights but do not fit the description of British and Irish are excluded and experience the hard border on a daily basis. Most of the people who are affected by it are from Africa, Asia, and South America. Many of them who live here, they have the right to live in the island of Ireland. They are not illegal immigrants. They have paid so much money to come and live, even paid so much money to become citizens, but still will be stopped to move freely until they prove that they have the right to be here. It is not a theoretical issue. The restrictions have a detrimental impact on the daily lives of so many people. And I would like to share some of the examples that we deal with on a daily basis in my work. Now, you all know that there's only one pediatric cardiology unit on the island of Ireland in Dublin. This means that a child, a refugee child or a migrant worker child with a heart condition may be unable to access urgent care without a visa. Applying a visa is a very expensive and strenuous affair. It takes 2 months to process the visa, and you have to apply it through London, a payment of €100, and hundreds of supporting documents that you have to provide for you to get that visa. Families are denied the right to drop off children in their schools, attend parents' meeting, take children to social events, or take part in any school initiatives. I have examples of spouses married to Irish citizens who live in Como and others live in Moff, Donegal. Children go to school in Derry, but parents are excluded from participating in their children's school events or even contributing in their schools' activities because they do not have the right to travel across the border. The mental health impact on young people who have been excluded from cross-border trips, going for sports activities and day trips to the beach with other peers is unbelievable. Anyone not covered by the Common Travel Area, particularly non-European citizens, may be asked to show their passport when traveling within the island. One recent example brought to my attention is an immigration gatherer and UK border forces are now working together, carrying out spot checks on buses and trains traveling between Belfast and Derry and Dublin. But rather than asking all passengers to show their ID, they have been singling out Black and brown people. These are not just a few examples of people illustrating the similarities between the common travel area and rules that are very close to the apartheid past laws. They are real stories of people who live within our communities here. And this is why days like International Day for Elimination of Racial Discriminations are necessary to mark here as the fight against racial discrimination goes on. We are keen to make sure that this is just not a campaign for Northwest Migrants Forum or a campaign for minority ethnic people only. Rather, it should be something that all of us who want an open, inclusive, and shared future, and in particular for everyone who live in this city and district, be able to enjoy the rights most of us take for granted and can easily throw their weight behind this campaign. As a council, we are in a unique and privileged position, which allows us to go beyond words of solidarity and take real practical actions that will influence positive change for citizens and residents within our city and district. So allowing those of us who have made this city and region our home to fully belong. And this is why I think it is really important that we support this public call to action to say no to racist borders in the island of Ireland. Thank you, and I second the motion.
Thank you, Councillor Barr-Lillian. So, folks, we have a motion in front of us. Seconder, is there anybody else to speak to it or wishes to speak to it? Nobody else wishes to speak to it. It's proposed by Councillor Harkin and seconded by Councillor Seymour Barr. And unless I have anybody to speak against it, I'm going to take it as read, as accepted. Okay, thank you. Folks, moving on to item 7. Matters arising from the open minutes of Health and Community Committee held on Thursday, the 10th of February. For accuracy, pages 9 to 38. Proposer and seconder, please. Councillor Tierney, Brian, thank you. Councillor Farrell, Rory. Proposed and seconded, thank you. Matters arising, members, pages 9 to 38. 9 to 38. Matters arising. Councillor Barr-Lillian.
Chair, that was
Councillor.
earlier.
Sorry?
That was earlier.
That was earlier. My apologies. My apologies. Councillor Ferguson, Rachel.
Thank you, Chair. Chair, HC 4822. It's just on the mental health strategy, and it's just basically around the mental health strategy. Chair, I met with ARC recently in the City and District, addiction recovery. Of course, we know addiction and mental health goes hand in hand, and ARC do some amazing work here in the City and District, offering ways to tackle addiction through fitness and counselling and peer-led support. They also support for families, mental health support for anyone, family members who have anyone dealing with addiction, and they're looking to grow and the service for the demand. ARC have been born out of the need to not wait for 6 weeks for a service. They know only too well how when someone needs support, as soon as they come forward to ask, it should be in place as quickly as possible. Unfortunately, it means their success their success has been so great that it means now that they do need to rely on donations and funding streams and volunteers Their program also has a support for businesses and staff so that if you can go through them and they can help anybody in your staff that could be suffering from a substance abuse or addiction. But one of the things that they did say to me and they would love to do is to come into council and present and also maybe become part of the Mayor's Civic Forum. They're trying to get a bit of support from council and council officers on funding streams and bigger pots so that they can grow that service. So, Chair, I'm wondering if it's okay if we could propose that ARC is added to the list to make a deputation to our committee.
You proposing that, Councillor Ferguson?
Yes, Chair, I'll propose it and I'll put it in the chat box now.
Councillor Farrell, Rory,
That's okay.
Yeah, happy to second, Chair. I think it's a great proposal. I think everybody's well aware of the sterling work that ARC does on a daily basis. They assist people that are recovering from various addictions. And I, for one, would love to have them here in the committee so we can hear that firsthand. So I think it's an excellent idea. Happy to second.
Councillor McGinley, Emma?
Gormega, Chair. I was going to second it there, but Councillor Farrell got on before me. No, happy enough for that proposal. I was actually at the OLT's AGM there on Tuesday, and there was a presentation from, they do a bit of partnership work with ARC as well, and supporting people from the Craigan area suffering with addiction and their health and fitness as part of their Communities and Transitions programme. So the work at ARC's doing, it's reaching every community across our district. So I'd be more than happy to bring them in and to hear from them and support them whatever way we can. Gormega.
Thank you, Emma. Proposed by Councillor Ferguson, seconded by Councillor Farrell. Rory, and I'm not seeing or hearing anything against that proposal. I just haven't spoken to the Seamus, the director. In terms of the Civic Forum, that shouldn't be an issue either. Okay, Councillor Ferguson. Members, any other matters arising from the minutes of Thursday, the 10th of February? Councillor Tierney, Brian.
You Chair, HC 34 /22 Rosemount Resource Centre. And I do note that there's a comment, I suppose the best way to put it, in the correspondence of today's meeting pack relating to the declining of an invitation to come before a special committee meeting. But I'm just wondering, Chairman, why the written submission from the three individuals wasn't attached or isn't attached to today's pack. I appreciate that it says that it will be April, but why April? My understanding is we received that written submission well before the deadline for papers for this month. So why is it not on today's agenda? Thank you.
Chair, I'm not aware of it being received in our directorate, but I will double check for you.
It's on today's paper.
All
It's
right.
on today's correspondence.
Okay, thank you.
Hussey, Derek.
Thank you, Chair. I should have brought it up under accuracy. 35/22, page 15, second last paragraph. Myself welcome the update provided. Proposed the reopening of the centre. I'm not a member of committee, Chair, and I would not have proposed anything. So it's really just a matter of accuracy to be noted. Thank you, Chair.
Thank you, Derek. Any further matters arising of the minutes of 10th of February? If not, I'm going to move on. And folks, that's 5 to 6. If we maybe take a break to 6:10 and see people back here 6:10. Okay, thank you. Okay, members, officers, well, welcome back. If we're moving on with the agenda and item 8, and I could ask Barry to take that, please.
Thanks, Chair. Members, the purpose of this report is to seek your approval on the action plans received for Strabane Town and the Mirror DA in relation to the Food and Essential Items Transition Fund. Members, you'll recall that DFC allocated the council 165,000 back in March, and this was carried over into council reserves to allow spend into the new financial year. Previously approved 36,000 of the allocation to go to lead partners in each of the DEA as part of the exit to the Access to Food programme, and this has left the remaining £129,105 to be utilised as part of a transitioned programme in each of the 7 DEAs and Strabane Town. Officers from our community development team have been liaising in recent months with the 8 growth partnerships to support the development of proposals, and to date proposals have been received for Strabane Town and the Mirror DEA, and you'll see those in your appendices 1 and 2. It's anticipated we'll get the other proposals for the other DEAs over the next number of months, members. In terms of each DEA, there's been an allocation of 16,138, and the proposal submission will provide an indicative breakdown of the associated costs relating to the delivery and implementation of each proposal. The remaining allocation, members, from a financial point of view from DFC does not require match funding from council, and it's been carried over from the last financial years I've previously highlighted. So in terms of the recommendations, that members approve the total funding programme allocation of 129,105 and 59 pence to each of the 7 DAs in Strabane Town, and that members approve the allocation of 16,138 to the lead group for Strabane proposal, the Strabane Health Improvement Project, and that members approve the allocation of 16,138 to the lead group Triax Neighbourhood Partnership Board for the Mirror DA, and you'll see the members in both appendices 1 and 2. Thanks, Chair.
I just see a number of, or one conflict of interest in terms of the community or the partnerships, and I would declare an interest as well, being a member of the FAHAN. I see Michaela Boyle, Councillor Boyle has declared an interest, has been a member of SPARE. I think we're all members of boards, aren't we? All councillors. So I think it maybe is a general declaration of interest. Okay, folks, that's item 8 that's set out. Anybody to speak to it? Councillor Farrell, Rory?
So proposed.
Proposed. Okay, folks, proposed. Seconder?
I'll second it there.
Okay, thank you, Councillor McGinley.
Can I ask a quick question then?
Of course, of course.
Just in relation to the funding for the other DEAs that we don't have their proposals yet, in relation to timelines of getting the money spent, where I know that the paper says you'll receive it over the next couple of months, their proposals. Are we confident that if we're going to receive them over the next couple of months, that we're going to have this money spent in time if there is a deadline?
Through yourself, Chair, yeah, there's no difficulty there. We've carried that over from the previous financial year. So yeah, we'll get that spent. So we've allowed the groups time to get their proposals right, and we'll bring those in over the next couple of months for each of the other DAs.
Thank you.
Thank you, Brian Barry. Declaration of interest from Councillor Ferguson and with regards to the FAHAN partnership. Folks have a proposer and seconder from item 8. I don't see any further speakers unless anybody has any untoward to say, or not untoward, that's all. Anything to say in relation to it, we take it as read, item 8, and move on to item 9, ask Barry again.
Members, the purpose of this report is to seek your approval on the consensual grant making action plans 21-22 received for the Derg DA and Ballyarnett DA, and to seek your approval to issue a letter of offer to the lead group Georgetown for the 7,500 previously awarded to Derg Valley Care in order to deliver on a youth leadership programme. In relation, members, to that second recommendation, within the Derg action plan, the total project cost is 22,500, 15 of this from the consensual grant funding, and the remaining 7.5 is carried over from the 19-20 financial year allocation previously awarded in a letter of offer to the lead group appointed by the Derg Local Growth Partnership at the time, Derg Valley Care, Notification has recently been received by Council that Derg Valley Care that 7,500 allocated to health MOT checks was not able to go ahead as planned due to COVID and the health pandemic. The Derg partnership met to discuss the reprofile of the 7,500 towards delivering on the youth leadership programme as outlined in Appendix 2. So members, there's no financial implication to Council. 120,000, which is 15,000 per DA, is currently held, again, as the previous report, within Council reserves. So in terms of recommendations, that members approve and endorse the action plan submitted for the Derg and Ballyarnett, and that members approve the issue of the letter of offer to the lead group Churchtown for the 7,500 previously awarded to Derg Valley Care. Thank you.
If I could just notify, obviously, Alderman Hussey, Derek has put on a declaration of interest in terms of the Derg. Councillor Tierney, Brian, on item 9.
Chair, thank you. I have no issue with the report, and obviously no issue with the applications that have, or the action plan, sorry, that have come in. And I'm going to look to the officer for a wee bit of guidance. I am a member of the management board of On Street Community Youth. I am a member of obviously the Ballyarnett growth plan, and have been involved in work around the new Gaelic Community Centre. So I don't know if I can propose this or not. They're all non-pecuniary interests, obviously, but in relation to this, the Ballyarnett one in particular, you know, it's vital that this is actually able to go through, because the work around the community centre and all of that is going to be fantastic, but it needs set off, and it needs that work done. So it has the, and I suppose others can come in and talk about the Derg one, but this has the full support. If you look at the project management partner organisations, it's almost every group in the Ballyarnett DEA that are signing up and backing this programme or project that's been led by On Street Community, so it's vitally important that it goes through. I'm happy to propose it if I can, but I just don't know if I can. So I'm happy to leave it to someone else just to save.
Chair, I'm happy to propose.
There you go. There you go. As long as it's proposed, it doesn't matter who does it. I think it was Michaela Boyle, I think, maybe. I don't know.
Yes, it was. Yeah, Brian. Happy to propose.
Happy to second, Chair. Councillor Edwards.
It's done now. Oh, Jesus.
Well, I would have been happy to propose or second, but some members online beat me to it here. Happy to echo the comments from Councillor Tierney, and I'm going to speak very briefly, but specifically about Ballyarnett and the new Gaelic Community Centre. You know, it's a much needed facility. It's in an area of high need and well identified need, and this grant is going to help set this up with much needed equipment. So happy to support. Would have been happy to propose or second, but alas, not to be.
Councillor Boyle, Michaela.
Yeah, thank you, Chair, for letting me in. Again, just in terms of Castle Derg, I know it's not my electoral area, but I would have worked closely with the Churchtown Community Association in the past. I know the great work that the project leaders do there. So this funding would be very welcome in that area, particularly for the youth leadership programme. You know, it's an area, it's a rural area, and you know, when you take, for example, the audit that is being carried out currently on youth provision in our areas, Castle Derg would be one of the areas where there is, you know, very little provision in terms of programs and access to programs and other clubs and things for young people. So this money will be very welcome to engage with young people in the area. So I was happy to propose, as I'm not a member of that local growth partnership, but I'm sure the money for the both areas, Ballyarnett and Castle Derg, will be very much welcome. Thank you, Chair.
Thank you, Michaela. Councillor Edwards, Stephen.
Thanks, Chair. Just the same as Councillor Boyle there, I do welcome us, especially for the Derg, and as mentioned by Councillor Boyle as well, there's a massive lack in provision, and I know that I think Castle Derg High School there's going to be some investment put in there for youth services in Castlereagh. And I hope that this project can sort of marry in with that and bring everyone together and hopefully provide youth services that have been missing for a number of years out of Castlereagh. But fully happy with the proposal. Thank you, Chair.
Thank you, Stephen, and my apologies. I should have noted a declaration of interest from Alderman Kerrigan, Keith. Folks, it's proposed by, Alderman Hussey. Derek.
Thank you, Chair. Just very, very briefly, as Councillor Edwards was alluding to there, the scheme in the DERG is very much meant to be complementary to other provisions and projects that are ongoing within the entire area, including, as he mentioned, the revamping of the youth wing at Castlereagh High. So I trust that the committee will indeed endorse the recommendation. Thank you, Chair.
Thank you, Derek. Item 9 proposed by Councillor Boyle. Michaela, there was somebody else seconded. I just didn't catch who it was. If you could, who? Councillor Edwards, Stephen. Okay. Proposed and seconded, members, and I think everybody would be in agreement. So moving on to item 10 again, Barry, please.
Thanks, Chair. Members, the purpose of this report is to seek your approval of the Good Relations bid, the funding to the Executive Office 22-23 as part of our Council Good Relations programme. We received this invitation on the 18th of December, members, and members of the Good Relations Working Group met to discuss this on February, the 3rd of February 2022, and recommended the bid be submitted to TAO. It was submitted prior to the deadline, the 4th of February, and a copy is attached in your appendices. In terms of the overall cost, the bid is 572,615 pence, members, and 75% of that will be from the Executive Office. So in terms of the recommendation that members approve the Good Relations bid 22-23 as submitted to the Executive Office.
Yeah. Happy to propose, Chair.
Not just to say that I'm happy to second it. I probably a bit of a mute point, but just looking at the dates that the application went in and the obviously the invitation to apply was sent out, and then obviously Stormont, the Executive First Minister, has pulled out. Can this funding actually go ahead? Because this is a new tranche, as I understand it, of Good Relations funding, is it? So can this go ahead with the Executive, well, with the Executive Office no longer sitting?
Through yourself, Chair. Yeah, look, this is an annual bid and it's part of our 3-year Good Relations plan. So this has been ongoing for, I don't know, many years. So when the Executive hasn't set before, we've been able to apply to TAO and ensure that and get the money through, because as always, those budgets are always approved and within the Executive Office. So it hasn't been an issue before. It may delay the letters of offer, but that wouldn't be an unusual phenomenon in terms of getting the letters of offer for a Good Relations programme in the summer. And we've already carried out a quarter or more delivery. So no, it's not unusual, and we don't anticipate it will have any implications on the funding coming through.
Okay, folks, proposed and seconded. I don't see anybody saying anything different. So moving on to item 11, again, Barry, please.
Members, the purpose of this report is to update you on the operational plans for the new pontoon at Perhen Boathouse and to seek approval for facility and rental charges for club storage and to approve the appointment of LPS and the development of a licence agreement for identified club users. Members, work is currently underway for the construction of a new pontoon, and when fully completed and following contract to handover, the facility will serve local sports and activity clubs and promote access to the foil. In addition to the new pontoon, members previously approved the development of storage and accommodation based on user group requirements. In terms of conditions of use, officers are currently drawing up terms and conditions of use for the pontoon, and users will be required to agree to the terms and conditions and produce relevant documentation and insurance.
Thanks, Chair, and thanks, Barry, for the report. So obviously, we've got a fantastic asset in the foil, and we're trying to increase its usage through water sports, and this pontoon at the boathouse is one way to deliver that. But I've got a question regarding the £400 fee. Have we had any engagement with the user groups to see if they find that's an acceptable figure? And the second question is, when do we expect it to be operational? But happy to propose.
Through yourself, Chair, we will be operational in the next couple of months. I haven't got the final detail from the contractor, but it's pretty close to getting everything completed, including the storage. In terms of the £400 fee, that's been benchmarked against other similar facilities. We've had ongoing engagement with the clubs, and there hasn't been any opposition. There's been informal engagement, but as you'd be aware, £400 per year is not an awful amount for clubs. So we don't anticipate there'll be any opposition to that fee.
Okay, members, proposed and seconded item 11 in terms of Perhen pontoon or boathouse. Okay, moving on to item 12, and again, Aston Barry, please.
Thanks, Chair. Members, this is quite a detailed report, but we have some of the members on have received an elected member briefing on this particular project after this report was written. So in terms of, I'm not going to go into the detail of it, but in terms of the purpose of the report and the recommendations, members, firstly, to update you on the progress to date regarding the purchase of land at Spring Hill Park in Strabane from the Housing Executive, to seek members' approval to enter into a shared management agreement with Spring Hill Community Association to complete the purchase of the land and carry out small health and safety works at the existing building at an approximate cost of £3,650. And members, that will then be added to council stock, and the regular certification and health and safety checks will be carried out by the property team and indeed members of the Health and Community Directorate. The third recommendation, members, is to seek your approval to include Spring Hill Park on the capital list of projects, allocate a project manager from the capital team to progress the project, including approving the allocation of £70,000 towards developing the site for a new community facility. So members, this was written before we had the members briefing. The resource from the capital team has already been allocated, and we've identified the £70,000 through underspends from this financial year. And the final recommendation is seeking members' approval to give delegated authority to the Director of Health and Community to identify additional funding to the project should the project cost more than expected, given the current economic climate and increase in construction costs. So members, we don't have a detailed design on this yet in terms of the replacement of the prefab, and we're not quite sure, but we've used that 70,000 from underspends and the proposed allocation from the Department for Communities of 30,000. And if additional funding is required, we're seeking your approval for the director to have delegated authority not to hold up this project any further. So there's quite a bit of detail, members, but we've previously presented that to you and happy to answer any questions around any of that detail. Thanks.
Okay, Barry, thanking you. Folks, that's item 12. Anybody to speak to?
Chair, can I speak?
Michaela, is that Michaela?
Yeah.
Go ahead, Councillor
Sorry, I
Boyle.
didn't put my name in the chat box there, Chair. No, happy to propose and approve for delegated authority and for the funding and for this project to move forward. And I just want to say thanks to Barry, Karen and the team for the work that they've done on this to date. And I appreciate, and I do, you know, others within the Strabane area, other elected reps and those within the neighbourhood renewal team really appreciate the work that they've done to date thus far on this. So happy to approve, propose that. Thank you, Chair.
Thank you, Councillor Boyle. Councillor Edwards, Stephen.
Chair, thanks for bringing me in. And like Councillor Boyle, I think this is definitely positive for the Spring Hill area. Happy to second the proposal. I think it'd be good for the wider, excuse me, Chair, Spring Hill area to have their own dedicated new facility. It's desperately needed. And I know the work that goes on with the community groups there is second to none. They're doing a great job there, and they definitely deserve this, Chair. Just, excuse me, Chair, a quick one for Barry. You say that the money has been found by underspend within the capital project. Is there any indication what that overall underspend is within the capital budget? I'm wondering, does it have that? Or is there, you know, plans for other sort of community buildings throughout other parts of council? Thinking in particular of, for example, the Glebe and Muon DA, they're in desperate need of a new facility up there. But I'd be just interested to know what the underspend is in terms of the capital projects relating to these community centres. Thank you, Chair.
Through yourself, Chair. The capital budget will be discussed at a capital working group meeting and then subsequently council. The underspends here is found through revenue budgets. This is a project that members and the chief executive have asked to be prioritised. So we're finding the 70,000 from revenue underspends within both this department and other budgets identified by the lead finance officer. So this isn't capital underspends. Those are dealt with directly and prioritised through capital working group and subsequently council. This is indeed revenue funding that we have found underspends from. Thanks, Chair.
And you, Barry. Thanks, Stephen. Alderman Hussey, and a question to yourself, Barry.
Thank you, Chair, and thanks, Barry. Of course, welcome the Spring Hill proposals. There've been quite a bit of angst with, you know, various issues around the Spring Hill, Porty Cabin, and all of that sort of stuff. Hopefully, that's being resolved. Chair, there is another site in Strabane which was brought to attention of council, and that I know various groups, community type groups in the area are interested in, and that would be the eventual disposal of the Education Authority site at the former grammar school on the Liskew Road. I know that we've received a booklet outlining plans that a group have for the historic Alexander site, house site within the EA grounds. But I also understand that Strabane Rugby Club would have an interest in the rugby pitch, which they formerly had permission to use from the school when it was in situ. And I believe, Barry, you may have received communication about this from the club. So has there been any engagement with the Education Authority with regard to community transfer? Because there are community groups in the area who are interested in this site, and surely it's something that this council should be pursuing. Thank you, Chair.
I'll come in. Yeah, I can answer the bit about the correspondence with the rugby club, Alderman Hussey. And there was an email come in earlier in the week in terms of an ask, but I was unsure of what they were actually asking me. So I have went back to them through correspondence to ask what were they asking me. They didn't make it clear it was in relation to this site. So the team are meeting with them as well to discuss this going forward. So yeah, there is correspondence in the system. I think it arrived on Tuesday, but we've been back asking a bit of clarity what they're looking from council on this in terms of support. And is that a partnership approach through engaging with the Education Authority. So that's something we'll be exploring over the next number of weeks and months once we get clarity from the club. In terms of engagement with the Education Authority, I haven't had any to date, but I'm not sure if Karen's aware of any through other directorates or within council. Is it?
Chair, I suppose just to elaborate on that response, there has been some preliminary discussion across directorates as to the feasibility of various proposals that have been brought to council. There's been a previous motion in relation to mixed use, sporting use, and also in relation to the heritage use. So those discussions have taken place with a view of informing the Capital Working Group when that convenes. Very preliminary conversations with EA in relation to the timeline for disposal. At the point that we undertook that, they weren't in a position to confirm what that timeline would be. So again, the Capital Working Group will be updated in due course as to when and if we anticipate that formal disposal process to commence, because you'll know until very recently there had been a level of use on the school site. In terms of community asset transfer, yeah, we're aware of some funding potential around community ownership through the Levelling Up Fund, and we're preliminarily scoping and exploring the opportunities across the district. But obviously those applications would need to be community-based and community-led, because although the criteria is not published for the second round of that funding, the councils were excluded as being applicants in the previous round. So members, I suppose, in short, the update on that proposal will come through the Capital Working Group.
Thank you, Karen and Barry. Alderman Hussey.
Yeah, I welcome the replies that there is still consideration with regard to the site. And I suppose, although council cannot be directly, the purchaser or whatever, they can certainly provide the catalyst for the future community development on that site. And I trust that is the way that it's been taken forward. Thank you, Chair. Appreciate that.
Thank you, Alderman Hussey. Item 12, proposed and seconded. Members, and I don't hear anything to the contrary, so I'm going to move on. Ask Barry to take item 13, please.
Thanks, Chair. Members, this report's to update you on the recently announced fair funding salary uplift programme and to provide approved allocations to the 3 local advice providers. Members, you'll be aware of the announcement from the DFC Minister to implement a fair funder uplift in neighbourhood renewal and the wider C&V sector posts funded by the department. And this announcement includes the post directly funded through the Welfare Reform Mitigations Package. And members will be aware of the allocations provided under this element of support as outlined at our February Health and Community Committee. In order to mitigate the risk of inadvertently creating pay disparity for those VCS workers whose salaries are supported through some element of the Community Support Programme, the Minister had indicated that she would identify further funding in this regard. The Department has now provided councils with additional funding through the Community Support Programme for a funding salary uplift programme. And in relation to the percentage salary uplift, the Department has stated that it is content for councils to be flexible with organisations they fund to ensure they adhere to their own responsibilities as employers in relation to setting terms and conditions, including pay, pension and sickness policies. This flexibility relates to both the post directly funded through the Welfare Reform Mitigations Package and the further uplift for the CSP for funding salary uplift. Council, as you're aware, members don't fund salaries directly. We fund the organisations through commissioning agreements. Each employing organisation as employers will be responsible for the disbursement of funding under the Welfare Reform for Funding Salary Uplift and the CSP for Funding Salary Uplift programme in line with its own responsibilities as employers. This funding must be specifically allocated as salary uplift for the financial year beginning the 1st of April 2021 to the 31st of March this year and cannot be utilised for any other purpose. In terms of the finance, there are no implications to council at present as the uplift payments contained in the recommendations are paid 100% for the Department for Communities. The Department has provided a letter of variance to council for £89,054.49. So in terms of recommendations, members, that you approve the CSP for funding salary uplift allocations in line with percentage allocations based on the breakdown of hours per organisation funded under the CSP programme for 21-22 So you'll see there members Advice Northwest, Dove House and Resource Centre Derry with the allocations listed in the right-hand column. And the second is that members provide delegated authority to the Director of Health and Community to issue letters of offer to the 3 providers in advance of full council to enable spend within the current financial year. Members, we have 3 weeks left to get this money out and get it returns into DFC. So that's why we've asked for the delegated authority for the Director. Thanks, Chair.
You, Barry. Councillor Farrell, Rory.
Thanks, Chair, and thanks, Barry, for the report. Happy to propose on behalf of the SDLP, and I am a member of the Advice Services panel that came up with this. So I think everybody's aware that this was raised at our last Health and Community meeting, and 4 weeks later, we've got a resolution which I think everybody is happy with. So long story short, 90 grand has been made available by the Minister for Communities, which is very welcome. It's not often I would say that, but I am thankful to Deirdre Hargey for making this money available to provide a salary uplift to really, really hard-working advice providers in Resource Centre, Advice Northwest and Dove House. And we have, in the last month, we've had engagement with DFC. We've had 2 sets of engagement with the various advice providers. And at the end of the day, this is £90,000 that is going to go into the pockets of local people that have bent over backwards to help citizens across this city and district. So I think it's a good resolution. I've got one concern. It's welcome, it's long overdue, but it's a one-off. So the staff that are directly funded by DFC and these advice providers are getting a salary uplift, and it's permanent and it's ongoing. But the staff that are going to be assisted through this £90,000, it's a one-off allocation. They're going to get a bonus, and then their wages are going to go back to normal from April. So my question is, I understand this is a one-off allocation. Has there been any feedback from DFC to suggest that we could expect an annual recurring allocation to provide better pay, better salaries, better terms and conditions for the people not directly funded by DFC? But happy to propose on behalf of the SDLP. I'd like to thank the other members on the advice panel who worked collectively to come to this arrangement. And I note that delegated authority is needed in these circumstances, because if we were to agree this today, get it ratified at full council, it would have been too late to give the advice providers the money, because it needs to be spent by the 31st of March. So I think it's a good example of teamwork in the panel, but I'd be keen to get some sort of feedback on, is this going to be an annual allocation? Thank you.
Through yourself, Chair. Officers have had discussions with DFC officials looking at that, but there's been nothing confirmed and certainly no certainty around that, because of the uncertainty around budgets and everything else within the executive at present. But it is something that DFC officials are looking at, but they can't make any guarantees. Thanks, Chair.
Councillor Ferguson, Rachel.
Thank you, Chair, and thank you for the report. I wanted to say, I welcome the report. I'm supportive of the delegated authority, and I want to thank the advice providers in the department for meeting with us. We know there's still issues to the left. Councillor Farrell has outlined them, and there's been a lot of rush to get this scheme out. But I am thankful for the working group, and I'm pleased to see Councillor Farrell kept his word and thanking the Minister for the welcome funding during that meeting. But, like Councillor Farrell says, we need to get this money out. We need to get it out in time for wages, and we need to get it out before the end of the 31st of March. I think there was a sigh of relief when the advice providers came in and worked with us and found a fair way to get it out and make sure that everybody was happy. And I hope that continues to work. And that's a model we use going forward when it comes to our funding, that we do bring the advice providers in and the department in to make sure that everybody's happy. I hope we can continue to work towards making sure that all staff get the uplift, and that future funding, like Councillor Farrell said, and funders would reflect that uplift. I know that there's a lot of uncertainty around it, and we've said it many times. You know, our council pot for the advice providers isn't growing, but I'm glad to see that the staff will be getting the uplift, and I'm glad to see this report come through, and hopefully everybody in the committee will support it so that we can get it out as soon as possible. But happy to second, Chair. Thank you.
Thank you, Rachel. Councillor Harkin, Sean.
Thanks, Chair. Yeah, look, everybody in the advice sector deserves a pay raise, and I think that this money will be welcomed by the workers who see it in their pockets. I think that we were facing a potential crisis where some workers were going to get a raise and other workers weren't. It's good that the department has responded to that and come up with this money. I think I want to thank the advice providers for basically helping us figure out how to resolve this. And also, it was Jackie Gallagher from Advice Northwest who made the proposal around making sure that we got delegated authority, so we weren't we were actually able to utilize the money. So you know, we've a lot to thank our advice providers for, because they have literally bent over backwards over the last number of years during this pandemic, and most workers are simply not getting rewarded. I hope that people who receive this pay increase in this pay award will you know, see it as useful for them, and in part a recognition for the work that they're doing. I'm not going to you know, go over the top in terms of thanking the minister. I think, look, it's been far too long for workers in the community and voluntary sector to get a pay raise. There are still most workers in the community and voluntary sector are not getting a pay raise. And there was actually a lot of confusion about this based on statements that came out from the minister saying that you know, there was going to be pay increases across the board. That's not the case. And I think the campaigning that's happening for real pay raises needs to continue. And those pressures are only going to grow because, as everybody knows, you know, the advice providers provide brilliant help to people in need. But they themselves are struggling to pay their own bills. And I think that that's something that we need action on. I also think that we have to acknowledge, if we want to see these pay increases and better terms and conditions locked in, there has to be a change in the core funding from the department to our advice providers. It's been the same amount of core funding since 2015, and now we're in 2022. So that is putting huge pressure on advice providers. And you can just imagine the pressures in terms of improving people's pay and conditions. So I think that has to be, we need action in that. So I think we need to have a meeting with department officials to talk about how we can increase core funding. So in addition to voting through this pay award, I think I want to propose as well that the council agrees to meet with DFC officials to discuss increasing core funding from the very low 2015 level that it's at right now. And I'll put that in the chat. Thank you, Chair.
Thank you, Sean. Folks, can people see the proposal by Councillor Harkin? And we've already had Mr. Farrell, Rory.
I'd just like to speak on Councillor Harkin's proposal, if that's okay. Happy to support, but I would suggest instead of council, if I could just say the advice services panel. You know, there's a representative from each party and there's a representative from the independent bloc. And we have sort of developed a relationship with DFC. So I think it'd probably be more convenient for the council if it was the advice services panel. But happy to support nonetheless.
Thank you, Rory. Councillor Harkin.
happy for it to be the advice services panel.
Okay, folks, and without getting too mixed up on motions, but the original motion, Councillor Harkin, would yours be an amendment to that?
Chair, I'm happy if you take the first one and then come to this.
Okay, okay. Members, in regards to item 13, in terms of the original motion, which was proposed and seconded, and I don't see anybody speaking to the contrary, so I'm going to take the original motion as passed. And now you have a motion in front of you in terms of from Councillor Harkin and seconded by Councillor Farrell. And again, I don't see anything to the contrary. So if people are happy to take that as read, I will move on to item 14 and ask Barry.
Chair, members, the purpose of this report is to seek your endorsement of the consultation response in Appendix 1 to be submitted in relation to the draft advanced care planning policy for adults for Northern Ireland. Just a quick background, members will be aware the Department of Health has undertaken a consultation on a draft advanced care planning policy for adults in Northern Ireland related quality impact assessment. This policy will provide a framework for advanced care planning for adults 18 years and over, focusing on health and social care aspects. It has been developed to support a person to have greater choice and control over decisions, including plans for their future care and treatment. In terms of recommendation then, members consider and endorse the consultation response on the draft advanced care planning policy for adults aged 18 and over for Northern Ireland. Thanks, Chair.
Thank you, Barry. Anybody speak to it? Propose?
Is Chair Michaela here just to endorse it?
Okay.
Propose to endorse it.
Okay, thank you. Anybody else? Councillor Farrell, Rory?
Happy to second.
Okay, proposed and seconded, members. Okay, thank you. Moving on. Nearly speak. Moving on to item 15. Again, Barry, please.
Thanks, Chair, members. This is a further update from our last meeting with regards to this particular project, social supermarket. So the purpose of the report is to update you members on the social supermarket proposals received from the following delivery partners: the 8 growth partnerships, Apex Housing Association, Foyle Food Bank, Strabane Community Project, and the Churches Trust. Members, you'll recall the report was presented to the last committee in February in relation to the funding from the department, and a letter of offer received from DFC around £112,424 with a spend date of the 31st of March 2022. This report is to update members on the proposals received. An overview of the proposals submitted by the delivery partners is detailed in Appendix 1. All proposals received by the closing date of Monday the 21st of February have been approved by DFC as per the terms and conditions of their letter of variance. You have all of the details from the last report, members, in February. And in order to explore if any of this funding could be drawn down and spent by the 31st of March, delegated authority was granted to the Director of Health and Community in February to allocate this fund to delivery partners outlined in point 1 above. They all submitted, as I've highlighted, a viable proposal, and we've adhered to the procurement requirements and confirmed spend by the 31st of March. So from the finance point of view, members, you'll see previously mentioned 112,000, and there's no match funding requirement. So members, the recommendation is to note the contents of the report and approve the proposal submitted by delivery partners in the Appendix 1. Thanks, Chair.
Thank you, Barry. Councillor Farrell, Rory?
Happy to propose on behalf of the SDLP, but just a quick question. We had this debate at the last H&C meeting, and it was the age-old issue with DFC where at the very last minute they give us this pot of funding and say, this needs to be spent in like 6 weeks' time. And we thrashed this out at the last meeting, and I had asked a question of the director about, do we think our delivery partners can spend this before the end of March? And I think it was, look, we'll see. So the letter of offer is 112k. The projects that have been identified, is that 112,000? Is there any sort of slippage there, or are we going to be able to spend every single penny that the DFC have notionally provided to us? But happy to propose.
Through yourself, Chair, yeah, the indications are that spend will be achieved, but that is still, there's still 3 weeks to the end of financial year. So there is regular engagement with the group. So if there are issues around procurement or whatever, then that could be an issue. But at present, we're hopeful that will continue. But look, we will bring any detail back to members in a further report if full spend wasn't achieved.
Brian, thank you. Councillor Farrell. Proposed, folks, a seconder or anybody else to speak to it? Seconded by Councillor Tierney. Brian, thank you. Okay, folks, proposed and seconded, and unless I hear anything to the contrary, I'm going to move on and give Barry a rest. Seamus, please.
Thanks, Chair. Members, this report relates to the review of reduced fees for entertainment licences. You'll be aware that the hospitality industry have experienced difficulties as a result of the COVID-19 pandemic and the associated restrictions.
So proposed, members. Councillor Tierney.
Seconded, Farrell.
Seconded, Councillor Farrell. Okay, thanking you. Moving on to item 17. Seamus again, please.
Thanks, Chair. This report relates to the review of pavement cafe licensing. And by way of background, this committee has previously requested council officers to consider whether or not the fees for pavement cafe licenses could be reduced. A review of the fees has been carried out, and these are outlined in Appendix 1. The proposed fees offer a saving to applicants. However, prior to implementing the new fee structure, councils must carry out a consultation exercise prior to the fees being agreed. Chairs recommend a consultation process carried out on the proposed fee structure, that applications remain free of charge until 31st July 2022, and existing pavement cafe licenses be extended until the 30th of September 2022. Thank you, Chair.
Thank you, Seamus. Okay, members. Any thoughts? Any proposers? Seconders? Councillor Farrell, Rory.
See, the recommendation, it's 3 parts, but are we accepting all 3, or do we are accepting all 3? So happy enough for that. Happy to propose.
Thanking you, Councillor Farrell, Rory, for proposing. Councillor Tierney, Brian for seconding. Don't hear anything back from anybody else.
Chair, just to say, on behalf of Sinn Féin, we're happy to agree on that, on the way forward. Thank you.
Okay, thanking you, Michaela. And taking that as unanimous, or taking it as read. Members, 17. Members, the next number of items are for open for information, but obviously if anybody wishes to speak to any of them, so let me know now. Okay, folks, could I have a proposal again to confidential, proposed by Councillor Tierney, Brian, seconded by Councillor Farrell, Rory. And members, item 26, matters arising from the confidential minutes of our meeting held on the Thursday, the 10th of February. Thursday, the 10th of February, sorry, folks. Pages 243 to 246 for accuracy. Proposer and seconder. Brian, thank you. Councillor Tierney. Rory, thank you. Proposed and seconded. Members, any matters arising from pages 243 to 246? Thanking you. Just a notification there, people may see pecuniary department or declaration of interest, sorry, in terms of from Alderman Hussey from Derek. Regards items 16 and 17. Thanks. Thanks, Alderman Hussey. Moving on to item 27, Barry, please.
Thanks, Chair. Members, purposes to seek your approval to surrender Council's existing lease of part of the foreshore and bed at Lougfoyle Perhen and enter into a new lease with Crown Estate Commissioners for an extended area at the location. Members, this all relates to our plans that we've discussed previously about erecting the pontoon at the site, and it requires piles to be driven into the riverbed. So Council have entered into negotiations with Crown Estate Commissioners for a new lease of lands to facilitate this new pontoon, and they've agreed to grant